What we did traditionally in terms of mental health with students, I was a school social worker for 22 years, and it was very reactionary. We'd be reacting to situations. We didn't always know, what kids were struggling. We didn't ask them. We didn't know to ask them until they were in front of us and we knew they were struggling. But what we're doing now is this universal screener, asking kids where they are emotionally, and with that information, we can plan for them preventatively, which is awesome. And it's so much better because you can catch kids before it gets to the intense level where they're really feeling like they want to hurt themselves. So that's been the shift for me, is using data from this information that we gather to help drive what interventions and where I need to focus to give kids what they need, social, emotionally. Carrie, would you agree?
Yes, definitely. I can definitely go off what you're saying. I think, just even part of the reason I went into this field was for my own experiences in high school. And, back then you didn't have school psychologists, counselors, or support staff. And so I went into this field and I ended up at, the elementary level with a lot of background in RTI. But I think it was very shocking that we didn't talk about social, emotional, behavioral supports or any of those pieces at all. And so being on a pre-referral team or facilitating those teams, the discussions were always academic and always also were intertwined in that with the social emotional pieces, but no way to monitor them, no way to look at the data, no way to know if our interventions were working. And then when I ended up in administration, I think at the secondary level, the biggest piece, and you don't know what you don't know, but the reaction piece is, I think, the first time I sat as a coordinator of crisis support after the death of a student and thinking, I don't ever want to do this again. And I know statistically we will, but how do we start having conversations about how to prevent it? And I think I was, talking to, I think, Jim McDougall about, it's people are afraid to ask the question, but we know in all of our trainings, and all of the pieces that the programs that we've gone to, what is the first thing they tell you? Mental health first aid, SAVE, they say you have to ask, you have to be direct, you have to say, are you thinking about this? And that we were so afraid to ask the question. And so what I loved about the VIMUS when we first saw the self-screening tool was that it asked the question. So I think that's sort of how we ended up where we are here, following COVID, that we were so worried about our students and we needed a way to ask them how they're feeling.